Today I'm going to be talking about behavioral activation, which is one of the most effective ways of overcoming depression. Hi everyone. In today's video, I'm going to be talking about something called behavioral activation, which is a tool that you can use to increase your behavioral activity level even if you're experiencing symptoms of depression. And one of the things we know about depression is that it tends to sap a person's motivation and energy. And so today we're going to talk about how you become more behaviorally active, how you do more things, and how you resume doing those activities that you used to enjoy doing, even if you're feeling depressed. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a replacement or substitute for advice from your doctor or mental health professional. Now, with those things out of the way, let's talk about behavioral activation. So, as I mentioned in a previous video, one of the things that tends to drive depression is that people don't engage in activities that they enjoy doing when they feel depressed. They may stop doing recreational activities, they may withdraw socially, they may not be getting exercise, they may not be doing things that they know they should be doing, like cleaning the house or doing sort of chores around the home or getting work done. So the question becomes, if you're feeling depressed, how do you get the energy, how do you get the motivation to do these activities if part of the reason why you're doing these activities is because you're feeling depressed? And one of the things that can often trip people up is that they fall into what I call the trying harder problem. And I've talked about this in another video as well, where depression is actually maintained and driven by a person's desire to try harder, to try and do things and try and to achieve goals that they just don't have the energy and motivation to achieve. And so the thing with depression is that when a person's feeling depressed, they know the things that they ought to be doing to feel better. So this doesn't come as a surprise when we talk about what are some of the things you should be doing if you're feeling depressed to feel better. So I should be getting more exercise. I should be socializing with friends. I should be getting work done. I should be eating better. So people know what they ought to be doing. But the challenge is, if I don't have the energy and motivation to live up to those goals, then I'm going to continue to fail at achieving those goals, and that's just going to make me feel worse and make my depression worse in the long run. And so what I want to talk about is, how do you set goals to increase your behavioral activity that you can actually accomplish? And so today's video is really about setting goals to increase behavioral activity. Now, when you think of the term goals, if I were to ask you, what are some of your goals? Oftentimes my clients will say things like, well, my goal is to be successful at work. My goal is to have a family. My goal is to feel better. Now, the problem with those goals is that, while they're things to strive for, there's no clear sense of how exactly I'm going to get there, how exactly I'm going to achieve those goals. And so what I want to talk about is kind of a different way of thinking about goals. And this may seem as a very artificial way of thinking or considering goals, but what I find is that if you can set goals using these criteria that I'm going to be talking about, you're going to be able to achieve pretty much every goal that you set for yourself. And so when I talk about goals, goals have to meet 4 criteria. And I'm going to go through each of these criteria. And if you can, like I said, if you can be setting goals that meet these criteria, you're going to be successful at those goals. And what we know is that succeeding at achieving a goal helps build motivation and energy. And that's how you come out of depression. So the first feature of goals is that the goal has to be specific. In other words, do I know exactly what I need to do to achieve this goal? Now, people say, okay, yeah, a goal has to be specific. That's pretty obvious. And then I'll ask a client to set a goal, and they'll say something like, my goal is to lose 10 pounds. Well, that seems like a pretty specific goal. 10 pounds, losing 10 pounds. It doesn't seem like it gets all that more specific than that. The problem is, setting a goal like that doesn't give you any sense of direction for how to achieve that goal. So how am I going to lose 10 pounds? Am I going to lose 10 pounds by taking up running? Am I going to join a gym? Am I going to be eating more salad? Am I going to hire a personal trainer? Am I going to take up hiking? I don't know. I don't really have a clear sense or plan for how to achieve that goal. And if I don't have a clear sense of or plan, if I don't know exactly what it is that I need to accomplish that goal, then I'm less likely to be able to do it, and I'm less likely to succeed, and I'm going to be more likely to fail, which is just going to drive my mood down. So the goal has to be specific, and what I mean by that is I need to know exactly what it is that I need to do to accomplish that goal. So rather than a goal of my goal is to lose 10 pounds, the goal is my goal is to start taking up running. The second feature of goals is that the goal has to be defined in terms of my behavior, not how I feel doing the goal. So sometimes I'll have clients set goals like, my goal is to go for a run and feel really good after the run. Or my goal is to go to that party and really enjoy myself at the party. Well, do you see the problem with those goals? They almost have two components to them. One is the behavior that I'm actually doing. So my goal is to go for a run. Okay, that's fine. But the problem is the second part of it, which is my goal is to feel really good after doing the run. We don't have direct control over how we feel. If we did, then no one would ever feel depressed. We would just choose to feel good all the time. We would just choose to feel happy. So if I set a goal of going to the party and really enjoying myself, well, what happens if I go to the party and I don't have a good time? What if I feel uncomfortable and I don't feel like I've connected with anyone at the party? Will I have achieved my goal? No, I wouldn't have achieved my goal, because my goal wasn't to just go to the party. My goal was to go to the party and have a really good time. But I don't have control over having a really good time, and so I'm setting a goal that I'm likely to fail at, especially in the context of depression, where what we know is that in depression, people can experience something called anhedonia, which is a loss of pleasure or enjoyment in activities. So if my goal is go to the party and have a really good time, but the anhedonia is preventing me from having a really good time, I'm going to the party, but I'm still failing. So the idea is to just stick to what I call the old Nike logo, which is just do it. Just focus on the behavior. My goal is to go for a run. My goal is to go to the party. It doesn't matter if I enjoy myself on the run. It doesn't matter if I have a good time at the party. All that matters is me doing the goal. Now, a second part of this characteristic of goals is that the goal has to be defined in terms of my behavior, not the behavior of someone else. So sometimes clients will set goals like, my goal is to go for coffee with a friend. Now, it seems like a pretty straightforward goal, but what happens if you call up your friend and they would love to go for coffee with you, but they're just really busy this week and they can't make it. Well, have you achieved the goal? No. You haven't achieved the goal, but not because of anything within your control. You haven't achieved the goal because the goal was partly defined in terms of the behavior of someone else. And so the goal requires someone else to do something, and you don't have control over that. So a much better goal, a much more effective goal, is to set a goal like, my goal is to call up my friend and invite them for coffee. So notice it's a small change, but it's an important one, because what defines whether I've accomplished the goal is whether or not I pick up the phone and call my friend and invite them for coffee. If we end up going for coffee, great. But if we don't end up going for coffee, I've still achieved the goal, because the goal was defined in terms of my behavior, something that I was doing. So this idea that goals have to be behavioral, they have to be defined in terms of what I'm doing. The idea is to make accomplishing the goal 100% within my control. So it doesn't depend on how I feel, and it's not depending on someone else's behavior. And so if I can define a goal just by my behavior, I give myself a much better chance of accomplishing and succeeding at that goal. Now, the third characteristic of goals is that the goal has to have a clear end line. In other words, will I know, yes or no, whether or not I have succeeded? The thing is, depression loves ambiguity. If it's unclear whether or not you've accomplished the goal, that little depression gremlin on your shoulder is going to tell you that no matter what you've done, it's not enough. You haven't succeeded. Now, for some goals, this is pretty obvious. So if the goal is to pick up the phone and call my friend, if I pick up the phone and call my friend, I know pretty clear whether or not I've achieved the goal. But what about a goal like, my goal is to clean the kitchen? Well, I could spend, say, 2 hours cleaning the kitchen. And by the end of the 2 hours, I've done a lot in the kitchen, but that little depression gremlin on my shoulder is going to say to me, yeah, but you didn't pull all the cups and plates out of the cupboards and wipe down and bleach down all the cupboards. So you haven't fully cleaned the kitchen. You see, you're just failing again. You're not doing the full job. That's what depression is going to tell me. And I'm going to feel like I've failed. So in situations like that, where there is no clear end line, you have to figure out a way of making it a clear end line, of making it crystal clear, black and white, whether or not you've accomplished the goal. And so one of the things I will recommend for people is to set a time limit. So my goal is to clean the kitchen for 30 minutes. Start the oven timer. I start cleaning. When that oven timer goes off, regardless of how much I've done, regardless of how much I've completed the goal. So by setting a time limit, what you can do is make it really clear, have I accomplished the goal? Did I clean the kitchen for 30 minutes or did I not? So in that way, you can make it really clear whether or not you've accomplished the goal. You make a really clear end line to accomplish the goal. Now, the final feature of goals is what I like to call the 95% rule. Am I 95% certain I can accomplish this goal? So in other words, is the goal realistic? So I could set a goal, for example, of going to the gym 7 days a week and working out for 4 hours a day. Well, that's specific. I know exactly what it is I need to do. It's defined in terms of my behavior. There's a clear end line. I'll know whether or not I've accomplished the goal. But it's completely unrealistic. And so there's no point in setting a goal that I'm going to have failed to achieve, right? That's the whole trying too hard problem. I'm trying to do things that are way beyond what my level of energy and motivation is. And so the idea is to set a goal that you're 95% certain you can accomplish. So if you're only 80% certain you can accomplish the goal, make the goal smaller. So I might set a goal of, my goal is to go for an hour walk 3 times a week. But I start to think to myself, well, I haven't been walking that much lately. I'm not sure if I can do it. I really want to do it, but I'm not sure if I can. Well, then what I tell my clients is make the goal smaller. You know what? If you're not 95% certain you can go for 3 one-hour walks this week, set the goal of going for 2 half-hour walks. And if you're 95% certain that you can do those 2 half-hour walks, then do the 2 half-hour walks and make that the goal. Now, the thing with goals is you can do more than what you're setting as the goal. So I may set the goal of going for the 2 half-hour walks, but I end up going for 3 one-hour walks. That's great. I've accomplished the goal. But even if I don't go for those 3 one-hour walks, if I just go for the 2 half-hour walks, that's great as well. I've achieved the goal. So the idea of goal setting, and by setting goals that meet these 4 criteria, what you're doing is you're almost guaranteeing the likelihood that you're going to achieve the goal. And what you're doing is you're guaranteeing that you're going to be successful at achieving the goal. And that's how you rebuild that motivation and energy. Just as depression is caused by the trying too hard problem and failure sapping motivation and energy as you try to live up to goals that you can't accomplish. By setting goals that are realistic based on your level of energy, that you know exactly what you're supposed to do, that you're entirely in control of whether or not they get accomplished, and you're clear whether or not you've achieved those goals. If you can set those goals and succeed at those goals, it's going to build motivation and energy. And that's how you begin to start feeling better. And that's how you start to overcome the depression. So I hope that makes sense. I would love to hear some of your thoughts and ideas about this. I would love to hear some of the goals that you're thinking of setting for yourself. So please leave me some thoughts and comments and questions in the comments section down below. If you've been enjoying my videos and want to see more, please hit that subscribe button and notification bell, and you'll be alerted every week when I post a new video. So that's all for today's video. Thank you for making it all the way to the end of this video, and I will see you in the next one.